Hi guys, welcome back. It's Dr. Saru. Pleased to be back on your screens. Have you ever asked yourself if this is normal for my baby to do this, or is this abnormal for my baby to do this? Should I be asking or seeking help from the doctors, or is it something that will go away eventually? I'm here to talk about the harmless phenomenon, or the harmless things that we notice in our babies, or otherwise that could be dangerous in other setups, but these are clearly just harmless neonatal features. Sometimes they show, especially in the first few days after delivery. So join me today as we discuss these harmless things. I know it is a common practice that people often assume that when you're a new mom, automatically you are lost. But I want to start educating new moms so that you don't get too lost like I was. Imagine me. I was really lost when I was a new mom, thanks to my mother myself, who helped me to at least navigate the waters. You see, it's different even when you're a doctor while you're a mom than when you're a mom without being having the knowledge, because sometimes you start overthinking. You don't even think of the simple things like, oh, it could be this, it could be this. You automatically start thinking of the worst scenarios when you're a doctor mom, as opposed to when you're just like a regular mom, I suppose. Yeah, because of that knowledge that you have. Yeah, so unakuwa na wasiwasi, you tend to think, is my baby okay? We need to get a pediatrician consult. I think something is up. I'll tell you my personal story of what happened when I gave birth to my daughter a few years back. I was really scared, and then later on it dawned to me, after Dr. had now examined the child later on, that it was nothing to really worry about. So what are these harmless things that we want to talk about today? Actually, this is going to be a 3-part series because there are plenty much. There's some which are categorized in birth trauma, and some which are just normal physiological things that happen. So I'm going to be doing a series. I don't want to bore you and make it like a whole hour lecture, so I'm going to be doing like short maybe 20-15 minutes 3-part series. So welcome for part 1, and let's start. So number 1, physiological jaundice. I know most mothers are worried and they keep saying, oh, my child was treated for jaundice, my child this, my child was yellow. So I mean, there's something called pathological jaundice and now physiological jaundice. In this video here, I had talked about neonatal jaundice, and I think I quite went into depth to explain what it is. So for physiological jaundice, it's jaundice, it's yellowing of the skin and the sclera of the baby after 24 hours after birth. So kama umejifungua mtoto wako amaliza masaa 24, alafu sasa ndo uone ameanza kutoka ama kuwa na rangi hiyo ya yellow, si kitu ambacho kinakufaa kikutie wasiwasi vile, ila ni vizuri if your doctor gets to examine the child so that you can know if is it something that is serious or is something that is not. Okay, in most cases, what happens with physiological jaundice, it's because the child's liver is still quite immature and it cannot clear out the much bilirubin, or that component that that causes that yellowing of the skin and the sclera. So number 1, physiological jaundice. If it's jaundice that has happened after 24 hours post-delivery, that is physiological. So mainly taking the baby out to bask some sun, and after your doctor has advised other things that you can do, yes, that is totally okay and harmless. Pathological jaundice, on the other hand, which I'll not talk about because I've already talked about it in the other video, it is because there's some disease process, or there's something that is happening in the baby that is causing the jaundice to happen. It's not something that is quite harmless, could harm the baby, it could cause so many other dangerous things and complications. So it's best if you report it to the doctor. Even if it's physiological, it's past 24 hours, it's always good to get a doctor's opinion so that you may be able to know if it's something that needs just reassurance after your doctor has examined the baby, or something that needs medical intervention. So the second thing, when a baby, you just delivered your baby 2-3 hours, 4 hours, 5 hours, your baby starts to vomit and it's something clear like, or it has a bit of, looks like some saliva or some mucus, it shouldn't also worry you. At some point, the baby could have ingested the amniotic fluid, so anatoa tu hiyo maji yenye alikuwa amekunywa wakati huo, labda wakati anazaliwa. So si kitu cha kukushtua. I told you guys I'll tell you a personal story. So the same thing happened to me, and I didn't think it could be amniotic fluid that maybe was in excess, and that is what was causing my daughter to start vomiting. I was really scared, and I thought, okay, what can this be? Trying to dig into the vomiters to see if I can get anything, and it was quite clear. It looks like almost water, which was mucoid. But yes, again, it's always good to seek your doctor's opinion and to get that reassurance that everything is fine. Because when the doctor came, visited us, and he said everything is okay, I think it was just excess amniotic fluid, I was like, whew, thank God, because I was really getting stressed up. I was, it's not really easy when you have a sick child. I get it from a mother's point of view. So yes, number 2 is vomiting. So whenever you see your baby vomiting, at least a few hours, maybe like 12 hours post-delivery, 6 hours post-delivery, it shouldn't be an issue. And in most cases, at that point, you'll still be in hospital. So you can always just call the nurse who's there, the doctor who's there, to come check your baby, so that they tell you if there's something wrong or there's need for reassurance, to just tell you that everything is fine. The other thing, the third thing that I've seen most women also like worried about is transitional stool. So what is transitional stool? Sorry. In the first 12 to 24 hours, you'll notice that your baby passes some dark colored stool, almost black, greenish, very dark colored stool. It's almost like blackish. It's called meconium. That is the stool that the baby used to pass even when they were in your tummy. So after that, the 12-24 hours, in most cases, you'll now notice as you continue to breastfeed the baby, in the second, third day, they start having frequent stools which are almost brown, yellow, greenish or yellowish in color. That is called transitional stool, of which you shouldn't be worried or expect that the meconium is supposed to last longer, or be worried that the baby is having frequent bowel movement, because it's quite okay for a child to even go or pass stool even more than like sometimes 4 or 5 times in a day. If they're breastfeeding well and they don't have any other issues, that is fine. And baby stool, because they are on a liquid diet, is expected to be quite loose. Of course, you can differentiate between diarrhea and when it's just the normal kawaida loose baby stool. Yeah, so that is number 3. Number 4, constipation. Most frequently asked question: why my baby, this is day 3, they've not yet passed stool, what should I do? I'm worried sana na hiyo mnyamba yake inanuka vibaya, but hajaenda kuchoka choo, hajapupu. Nimekuwa nikiangalia anasusu, ananyamba, lakini hajapupu. Good point. Basically, if the baby is passing gas ama ananyamba, that's a plus, that's good. Sometimes neonates or infants can, especially ones who are just plainly either breastfed or sana wale ambao they are doing formula and they're being bottle fed, yeah, they tend to have these constipation episodes. So if you notice your kwamba like your child has not passed stool for almost like 5 days, but they are passing gas, ananyamba, mom, that's okay, just relax. Unless you see that the baby seems to be as if he's in pain, tumbo ni kama unaona anasikia maumivu kwa tumbo, ama uone like amekaa almost a whole day na hajanyamba, then that is when you're supposed to be worried about why the baby is not passing stool. In some cases, there are children or there are babies who stay for almost a week or 10 days without passing stool, and that's totally okay. If they're still breastfeeding well and they're passing gas, that is fine. They'll ultimately pass stool, and just be on the lookout because it tends to be a mess. It's like bad, but oh well, it's part of the things that we learn as mothers as we go by with time. Number 6, Mila. So have you ever noticed when a baby is born, kuna ile watu walikuwa nasema, oh, mimi nilinyonya sana ndo maana natoka maziwa kwenye pua. When you press, like, you find some white spottish coming out. Now they're almost similar to that, but I'm not saying about these ones zenye watu unakamua kwa mapua. They're two white spots, or rather white things that appear on the nose, just here on the nasolabial fold, and sometimes even on the cheek here. Quite harmless. They appear on day 2, 3, and by the time you're even coming out of the hospital, you might realize that the things are going away. So it's something that should not really worry you. They're just some yellow cystic things that always appear there. Also very harmless. The other beautiful thing, number 6, that we're going to talk about is Mongolian spots. You've ever seen a baby with a back that is has a black spot, and people tell you, oh, could be it's a beauty spot. In most cases it happens in the lumbosacral region, but there are people who have them on the hand, on the legs. They're just called Mongolian spots. They're black or dark bluish for people who are a bit light skinned, and they have no harm to your child, or even in part of growing up. What normally happens for those things to happen, for the Mongolian spots to develop, it's infiltration of melanocytes, the cells that are responsible for producing melanin, in deep dermis. Dermis is the layer, is one of the layers of the skin. We have epidermis and then dermis, so the one that is at the bottom. So there's infiltration of melanocyte in the dermis, and that is why you see that dark spot called Mongolian spots. And for the 7th thing for today, which will be the final for this episode, is toxic erythema. So for toxic erythema, it's also very, very, very harmless. I will put, like the picture you're seeing right now, that is an example of toxic erythema. So it's, you see, there are things that we've always been worried about as mothers, or and especially for Mongolian spot. One of the myths I had, even growing up as a child myself, I was told ati mtoto alichomeka na pupu kwa tumbo, but that is not the actual truth. There is no burning that happened. There was no burning that happened after delivery, before delivery. It is just something that is there, and it is because of now what I've explained, infiltration of melanocytes into the dermis. So now that you have known of all these things, and next week we're going to be learning more about the same, I just want to do a quick recap so that you may be able to understand exactly what we just talked about. So number 1, physiological jaundice. I told you this is jaundice that appears after 24 hours after delivery. Number 2, vomiting, which happens a few hours after delivery, and as I've told you, it is normally harmless, but you need to also, for all these conditions, you have to ask your doctor so that they can confirm if it's the harmless things we're talking about. So vomiting is normally caused because of excess amniotic fluid that was ingested by the baby. The 3rd thing we talked about is transitional stool, which initially it's dark colored, almost like black, which is meconium in the first 12 to 24 hours, and then after that now you get the normal poop for the baby. We talked about the 4th thing, which was Mila. I told you they happen on the nose and the nasolabial fold and on the cheeks. Quite harmless. They tend to disappear on their own. The 5th thing we talked about was Mongolian spots, ile ya mtu anasema mtoto alichomeka na poop, ambayo it's not actually correct, sorry. And the 3rd thing, and the 6th thing that we talked about today was Mila. No, sorry, constipation was actually before, but fine. The 5th thing that we talked about, the 6th thing that we talked about was constipation, and the 7th and the final thing was toxic erythema. So unless you have any other questions, don't be shy, comment down below. Don't forget to follow me on Instagram, Twitter, Facebook, and now finally I joined the TikTok family for shorter videos, and awesome videos too. You can always follow me on all those platforms so that we can continue to share and ask questions. Don't be shy, and if you feel your questions are a bit personal, don't be worried to DM me so that I can be able to understand where you're coming from better, and I can be able to assist with whatever knowledge that I have and I know how to. Until next time, be sure to catch part 2 of the same. Love and love, Dr. Saru.